Hey guys, what's going on? It's Joe from Iron Health here with Greg. This is our Jiu-jitsu series. I do Jiu-jitsu myself, so I know all you guys are hurting out there. So we're gonna go over some stuff that I see in the gym when we're rolling, and I also see in the clinic. So the first one is a UCL. What's the UCL? It's your medial elbow, the inside of your elbow. You see a lot of tears here because moves like Americanas, or if someone cranks an arm bar or something on you, it really stresses this inside of the elbow, right? So common signs that you first should be aware of is it's very tenderness right on that inside of the joint. Kind of you poke right there and it's very tender. That can be a UCL injury, all right? So that's what you have to know. Like if you poke and it's tender, it could be UCL. Signs that I don't like, honestly, that you probably should get further care for. If you have numbness and tingling down the last two fingers here, ring finger and your pinky, you're getting some nerve issues going on because there is a nerve that runs right through here. And sometimes it can be displaced at the elbow, sometimes it can be pinched. So you can have these UCL injuries with this. These are just things to manage. The first way to manage it is, if you're in Americana, tap early, don't stay in there. Don't, put your ego away. Put your ego away. Tap it. Because this is a very vulnerable joint. Any type of position where we're putting that stress here, it's not meant to go that way. That's why these moves are made, right? So a couple tests I do in the clinic. One, I'll just kind of palpate, see where it's tender, stuff like that, and see what's going on, right? UCL is right there. It's going to be point tender on someone that has that. Second one I like to do is I like to take a nerve test to really look at the nerve. So I'll show on Greg, but ideally I would have his arm back, but we'll be here for now. I'm just straightening the elbow and pushing the hand back. And if he gets some numbness, tingling, it could be indicative that the nerve's involved as well. All right, the next one we do, if you have a friend, you trust somebody in the gym who's not gonna crush you, who's not gonna blow your elbow, it's in this position, what I like to do is stabilize the bottom of the elbow and kind of just move the top of the arm. And what I'm doing is I'm stressing this area right here, okay? And they'll feel that right in that joint line. And that can be the UCL, right? Now, a big test would be here. I'm stabilizing and I'm actually testing the ligament. So I'm stabilizing the humerus and I'm moving the lower arm. And a lot of times if the UCL is torn, we'll catch that right in assessment, okay? And you might get numbness and tingling there too. So these are the assessment factors. But look at this position, guys, right? That's the Americana, right? Right in that position, we're stressing that area. So that's where that ligament tends to kind of blow up and get symptoms. So it's just something to monitor there. Just be careful in that position. A couple other things I see with the UCL too is in this position, like let's say someone has you in side control and they're kind of compressing on the forearm, you'll get a pressure in the inside of the elbow. Be careful with that too, because that pressure, if that UCL is damaged at all, can really affect that ligament. So those are some ways to assess and see if it's UCL involvement. Check out the exercises next.